Dr. Dimitri, can you tell us about the health program that you are working with, Special Olympics Bharat, Special Olympics Asia Pacific, and worldwide? What is the scenario, and how are you working with the challenges that you have? Because I assume that you have to reach a very big geography, but with a very limited period of volunteers and specialists, and because the sensitivity of it of people need, special athletes need, is also very different, and not much is known and not much is recognized.
Yeah, thank you. It's an excellent question. You know, the truth is our healthy athlete screening is not the entirety of the solution to the health inequities that people with IDD face. It's a part of it. So it's not just the athletes that we screen, it's the healthcare professionals and volunteers who participate in it. And as a result, they get useful skills in treating people with IDD. And frankly, they get inspired because they interact with the amazing athletes and see that people with IDD have so much to offer, that they have a common humanity with all of us, and that they're deserving of respect and equitable care. So the solution to solving the inequities for people with IDD is going to require changes on many, many fronts.
How do you see, one, the medical fraternity should look into it, and other is general public should look into it, because identifying people with intellectual issues, what we call is IQ level or EQ level, is tough. And in a country like India, where we have a very diverse educational background and the medical facility is already stressed, so how do you work into that?
Well, you know, I mentioned we need to have earlier intervention programs, which we have, to identify children earlier, because we know that early intervention makes a big difference. So identifying the typical child, for example, with autism in the world isn't identified before the age of 10. It's way too late, especially because we know that early intervention programs make a difference, and the earlier we intervene, the more effective they are. So we need to have better screening programs, and we have such a program in our young athletes that's available free to young children to participate in. You raise a really important question, though, because this is going to require health system reform broadly, so that the natural people to be doing these screenings isn't Special Olympics, it's frontline medical providers who need to be screening children for developmental delays from birth onwards. And the truth is that parents also face a lot of concerns, a lot of stigma in many societies about their child having IDD, and they hide it from themselves, they hide it from their children, they hide it from society, and I think that's really unfortunate, and that's one of the things that Special Olympics is really trying to do by building a more inclusive society, by showcasing our athletes, by giving them a place to shine, by building their self-confidence, and by building our confidence in them by seeing all the amazing things that they can do. We really are very, very focused on eliminating stigma of people with IDD. I think it's one of the biggest challenges we face.
If I may ask you to educate the people in India, what is different between Paralympic and Special Olympic? Because people feel that it is one and the same, and these are very, very stark differences.
I'm so glad you asked that. We get confused with them all the time. So there are three officially recognized by the International Olympic Committee events. There's the Olympics that everybody knows, the big one. There's the Paralympics, and there's Special Olympics. Paralympics is like the Olympics for people with disabilities. It's focused on elite athletes performing at very, very high levels, at levels, frankly, that the vast majority of the population could never achieve. Special Olympics is about participation and inclusion. It's about effort. And in fact, our motto is, let me win, but if I cannot win, let me be brave in the attempt. Special Olympics is about getting everybody out participating in sport. Now, we celebrate everybody who participates. We challenge them to do their best, but it's not about elite athletes at all. It's about elite people who participate in the movement and who come out and showcase what they can do and allow us to celebrate it. We get confused all of the time, and I think unfortunately for some people they think I'm not an elite athlete, or my child's not an elite athlete, therefore Special Olympics is not for me. Special Olympics is for everybody. Everybody with IDD is welcome, and I think everyone will find it a very enjoyable experience, no matter what their ability is. So thank you for asking that important question.
It is they not only motivate us, but they also encourage us. That is what I get from Special Olympic athlete. But bigger question is, you talked about bringing AI in your deliberation today. Tell us about how that could be possible, where medical facility could be given, AI could be used, and a bigger what you call geographical area could be tapped, and the number of athletes could be identified ASAP. You talk about the age difficulty, because they get identified by the age 10 or more. In Africa, it might be even more bigger challenge.
Yeah, actually, to be honest with you, many of our athletes, our number one diagnosis globally is unknown. People have never gotten a diagnosis. That we know they have IDD, but we don't know what the reason is, or they don't know what the reason is. There's potential, I think, for AI to help with that. But I want to focus specifically on the role that I see as AI, as I mentioned, being an important mediator for to help athletes, people with IDD, navigate the healthcare system, and to help providers provide more IDD-sensitive care. So, one thing that AI is great at is language. It's built on large language models. So I can take everything that I've just said to you and say, please make this understandable to someone who has a 5th grade reading level, and within a second, it will give me a very, very accurate reflection of what I'm saying, but at a level that's widely accessible. Doctors don't do a very good job of talking to people in a way that's understandable. And I might add, it's not just for people with IDD, it's for everybody. The reality is that AI as a mediator between a doctor and a patient has enormous potential to benefit the quality of that communication. It also has a training potential, right? So I can interact with an AI patient, if you will, with IDD and get feedback about how well I'm communicating, what level I'm speaking at. You know, when you design an inclusive society, the reality is that everybody benefits. I'll give you some examples. We build in many societies wheelchair ramps because for people in wheelchairs. But guess what? They work for bicycles. They work for people who are walking. It's a lot easier if you have a little bit of a troubled gait to go up a ramp than it is to go up to step up a curb. There's a whole company that was developed. It's called OXO. It developed kitchen products for people that have arthritis. And that's a very small population. But guess what they discovered very quickly? That if you design products that work for people with arthritis, they work even better for people without arthritis. So it's a very, very popular brand of kitchen products. Their primary users are not people with arthritis. It's people without arthritis who love how easy they are to use. So, you know, designing an inclusive society benefits everybody. And it's one more reason we need to do it.
One last question and a personal question. You may choose not to answer, or you may choose to speak. Yeah. What brought you to Special Olympics and getting to know and in detail and working on the health issues of them? Because they are generally worldwide not very recognized, very tough to get along, and even tougher to bring medical support to them, because that is a very, very emotional issue as well, because you talked about the personal issues of the parents and the families and the caregivers.
Yeah. So, I mean, I'll be totally honest. I've been with Special Olympics for a year. I've been a pediatrician for 35 years. I've cared for people with IDD. They're a big part of the practice, pediatric practice. And I've even done, and I'm primarily a scientist, I do research. That's what I normally do. And I've researched vulnerable populations for a living. That's what I've done. I have not focused on people with IDD. And frankly, I'm embarrassed by it. It was a mistake on my part. And I am fully committed to trying, not only for the rest of my career, to apply all of my skills to improving the health of people with IDD, but to get others to do it. I'm a professor of pediatrics. I talk to students and young faculty all over the world and let them know that this is a population that's been systematically neglected. You know, I mentioned before the premature death of people with IDD. In large part, the only way we're going to bridge that gap is by doing more research on people with IDD, and we've systematically excluded them. I've excluded them from research projects in the past that I've done. And like I said, I'm ashamed of that. That wasn't the right thing to do. We can do better, we need to do better, and I intend to be part of that process.
Thank you for not being apologetic, because that is something what is your passion now.
Yeah.
And thank you for sharing your wisdom with Vision Television World for a great human job that you're doing with Special Olympic athletes.
Thank you very much.